Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is hypoventilation. We are discussing the disturbances of respiration, and in this continuation of that video we are discussing about the hypoventilation. And hypoventilation is the decrease in pulmonary ventilation caused by the decrease in rate of force of breathing. Thus the amount of air moving in and out of lungs is reduced. So, what is hypoventilation? Hypoventilation is a decrease in pulmonary ventilation caused by decrease in rate or force of breathing, and thus the amount of air moving in and out of lungs is reduced. And the conditions when the hypoventilation occurs. Hypoventilation occurs when the respiratory centers are suppressed by administration of some drugs. It occurs during parietal partial paralysis of respiratory muscles also. Now, effects of hypoventilation. Hypoventilation results in development of hypoxia along with hypercapnia, and it increases the rate of force of respiration leading to dyspnea, and severe condition result in lethargy, coma, and death also. You can see that flowchart. The hypoventilation which leads to hypoxia and hypercapnia, which further stimulates the increase in rate and force of respiration, the dyspnea, and in severe condition, lethargy, coma, and even death also. Now, hypoxia. What is hypoxia? Hypoxia is defined as the reduced availability of oxygen or to the tissues. The term anoxia refers to the absence of oxygen. In olden days, the term anoxia was in use. Since there is no possibility for total absence of oxygen in living condition, use of this term is abandoned. Now, classification and causes of hypoxia. Four important factors which leads to hypoxia are oxygen tension in arterial blood, oxygen carrying capacity of blood, velocity of blood flow, utilization of oxygen by the cells. Now, on the basis of above above factors, hypoxia is classified into four types. One is hypoxic hypoxia, one is anemic hypoxia, then one is stagnant hypoxia, and one is histotoxic hypoxia. Each type of hypoxia may be acute or chronic. Simultaneously, two or more types of hypoxia may be present. So, first of all, hypoxic hypoxia. Hypoxic hypoxia means decreased oxygen content in the blood. It is also called arterial hypoxia, and causes for hypoxic hypoxia is caused by four factors. One is low oxygen tension in inspired or atmospheric air, which does not provide enough oxygen. Number two, respiratory disorders associated with the decreased pulmonary ventilation, which does not allow intake of enough oxygen. Number three, respiratory disorders associated with inadequate oxygenation in lungs, which does not allow diffusion of enough oxygen. And number four, the cardiac disorders in which the enough blood is not pumped to transport oxygen. Now, first, low oxygen tension in inspired air. Oxygen tension in inspired air is reduced in the following condition like high altitude, while breathing air in closed space, then while breathing gas mixture containing low partial pressure of oxygen (PO2). Then, because of this condition, the required quantity of oxygen cannot enter the lungs. Number two is respiratory disorders associated with the decreased pulmonary ventilation, and pulmonary ventilation decreases in the following conditions like obstruction of respiratory passage as in asthma, then nervous and mechanical hindrance to respiratory movements as in polymyelitis, depression of respiratory centers as in brain tumors, then pneumothorax. In these conditions, even though the enough oxygen is available in the atmosphere, it cannot reach the lungs. And number three, which is respiratory disorders associated with inadequate oxygenation of blood in lungs. Inadequate oxygenation of blood in lungs occurs in the following conditions like impaired alveolar diffusion as in emphysema, then presence of non-functioning alveoli as in fibrosis, filling of alveoli with fluid as in pulmonary edema, pneumonia, pulmonary hemorrhage, collapse of lungs as in bronchiolar obstruction, lack of surfactant, abnormal pleural cavity such as pneumothorax, hydrothorax, hemothorax, and pyothorax, and increased venous admixture as in case of bronchitis. In this condition, in spite of oxygen availability, the entrance of oxygen into the alveoli it cannot diffuse into the blood. Number 4 is cardiac disorders. In congestive heart failure, oxygen availability and diffusion are normal, but the blood cannot be pumped from the heart properly. Now, characteristic feature of the hypoxic hypoxia. The hypoxic hypoxia is characterized by reduced oxygen tension in arterial blood. All the other features remain normal. Now, anemic hypoxia. Anemic hypoxia is the condition characterized by the inability of blood to carry enough amount of oxygen. And oxygen availability is normal, but the blood is not able to take up sufficient amount of oxygen due to anemic condition. Now, causes for anemic hypoxia. Any condition that causes anemia can cause anemic hypoxia. It is caused by the following condition like decreased number of RBC, decreased hemoglobin content in the blood, formation of altered hemoglobin, and combination of hemoglobin with gases other than oxygen and carbon dioxide. First, decreased number of RBC. RBC decreases in condition like bone marrow disease and hemorrhage. Decreased hemoglobin content in the blood, the condition in which the RBC count or change in the structure or shape and size of RBC, macrocytes, spherocytes, sickle cell, poikilocytes, etc. can decrease the hemoglobin content in the blood. Number 3 is formation of altered hemoglobin. Poisoning with chlorates, nitrates, ferrocyanate, etc. causes oxidation of iron into ferric form, and the hemoglobin is known as methemoglobin, and methemoglobin cannot combine with oxygen, thus the quantity of hemoglobin available for oxygen transport is decreased. And number 3 now we have discussed 3 points, and number 4 is combination of hemoglobin with gases other than oxygen and carbon dioxide. When hemoglobin combines with the carbon monoxide, hydrogen sulfide or nitrous oxide, it loses the capacity to transport oxygen. Now, characteristic features of anemic hypoxia. Anemic hypoxia is characterized by decreased oxygen carrying capacity of blood. All other features remain normal. And number 3 is stagnant hypoxia. Stagnant hypoxia is a hypoxia caused by the decreased velocity of blood flow, and it is otherwise called hypokinetic hypoxia. Causes for stagnant hypoxia are: stagnant hypoxia occurs mainly due to reduction in the velocity of blood flow, and velocity of blood flow decreases in the following conditions like congestive cardiac failure, hemorrhage, surgical shock, vasospasm, thrombosis, embolism, etc. Now, characteristic features of stagnant hypoxia. Stagnant hypoxia is characterized by decreased velocity of blood flow. All other features remain normal. And histotoxic hypoxia. Histotoxic hypoxia is the type of hypoxia produced by the inability of tissues to utilize the oxygen, and causes for histotoxic hypoxia. It occurs due to the cyanide or sulfide poisoning, and these poisonous substances destroy the cellular oxidative enzymes, and there is complete paralysis of cytochrome oxidase system. So even if the oxygen is supplied, the tissues are not in a position to utilize it. And characteristic feature of histotoxic hypoxia: it is characterized by inability of tissues to utilize oxygen even if it is delivered. All other features remain normal. If we take a comparative table, then the features: the partial pressure of oxygen in arterial blood in hypoxic hypoxia, it is reduced, anemic it is normal, stagnant normal, and histotoxic normal. Oxygen carrying capacity of blood in hypoxic normal, anemic reduced, stagnant normal, histotoxic normal. Number 3 is velocity of blood flow. In case of hypoxic, anemic, and histotoxic, it is normal, but in case of stagnant, it is reduced. Now, utilization of oxygen by tissues is normal in case of hypoxic, anemic, and stagnant, but it is reduced in histotoxic. Now, efficacy of oxygen therapy: hypoxic hypoxia 100%, anemic 75%, stagnant less than nearly about 50%, but the histotoxic is not useful. It is. Now, effects of hypoxia: acute and severe hypoxia leads to unconsciousness. If not treated immediately, brain death occurs. Chronic hypoxia produces various symptoms in the body. Effects of hypoxia are immediate effects and the delayed effect. So first of all, immediate effect. Effects on blood. Hypoxia induces secretion the erythropoietin from the kidney, and erythropoietin increase the production of RBC, thus in turn increase the oxygen carrying capacity of blood. Now, effects on cardiovascular system. Initially, due to the reflex stimulation of cardiac and vasomotor centers, there is an increase in the rate and the force of contraction of heart, cardiac output, and blood pressure. Later, there is the reduction in the rate and force of contraction of heart, and cardiac output and the blood pressure are also decreased. And effects on respiration. Initially, respiratory rate increases due to chemoreceptor reflex. Because of this, large amount of carbon dioxide is washed out and leading to alkalemia. Later, the respiration tends to be shallow and periodic. Finally, the rate and force of breathing are reduced up to a great extent due to the failure of respiratory centers. Effects on digestive system. The hypoxia is associated with the loss of appetite, nausea, and vomiting, and mouth becomes dry and there is a feeling of thirst. Effect on kidney. Hypoxia causes increased secretion of erythropoietin from juxtaglomerular apparatus and alkaline urine is excreted. Now, effects on central nervous system. In the mild hypoxia, the symptoms are similar to those of alcoholic intoxication. Individual is depressed, apathetic, with general loss of self-control. The person becomes talkative, quarrelsome, ill-tempered, and rude. The person starts shouting, singing, or crying. There is a disorientation and loss of discriminative ability of and loss of power of judgment. Memory is impaired. Weakness and lack of coordination and fatigue of muscle are common in hypoxia. In hypoxia, acute and severe, there is a sudden loss of consciousness if not treated immediately. Coma occurs, which leads to death. Now, delayed effect of hypoxia. The delayed effects of appear depending upon the length and severity of the exposure to the hypoxia, and the person becomes highly irritable and develops symptoms of mountain sickness such as nausea, vomiting, and depression, weakness, and fatigue. Now, treatments of hypoxia, which is oxygen therapy. Best treatment for hypoxia is oxygen therapy. The treating the affected person with oxygen, pure oxygen or oxygen combined with another gas is administered. Oxygen therapy is carried out by two methods. One is by placing the patient's heads in a tent containing oxygen, and by allowing the patient to breathe oxygen either from a mask or an intranasal tube. Depending upon the situation, the oxygen therapy can be given either under normal atmospheric pressure or under high pressure, hyperbaric oxygen. In normal atmospheric pressure, with normal atmospheric pressure at 1 atmosphere, 760 mg, administration of pure oxygen is well tolerated by the patient for long hours. However, after 8 hours or more, lung tissue show fluid effusion and edema, and other tissues are not affected by very much because of hemoglobin oxygen buffer system. In high atmospheric pressure or hyperbaric oxygen. Hyperbaric oxygen is the pure oxygen with high atmospheric pressure of 2 or more than 2 atmosphere. Hyperbaric oxygen therapy is with 2 or 3 atmosphere is tolerated by the patient about 5 hours. During this period, the dissolved form of oxygen increases in the arterial blood because the oxygen carrying capacity of hemoglobin is limited. At this level, tissue oxygen extension also increases about 200 mmHg, and however, tissues tolerate this high partial pressure oxygen without much adverse effects, but oxygen toxicity develops when pure oxygen is administered for long periods. Refer oxygen toxicity. Now, efficacy of oxygen therapy in different types of hypoxia. Oxygen therapy is the best treatment for hypoxia, but it is not effective equally in all types of hypoxia. Value of oxygen therapy depends upon the type of hypoxia, so before deciding the oxygen therapy, one should recall the physiological basis of different types of hypoxia. In hypoxic hypoxia, the oxygen therapy is 100% useful. In anemic hypoxia, oxygen therapy is moderately effective, it is about 70%. And in stagnant, its effectiveness is less than 50%, and in histotoxic, the oxygen therapy is not useful at all. It is because even if oxygen is delivered, the cells cannot utilize the oxygen. So this is our today's topic. We will discuss the oxygen toxicity and other topics in the next video. Thank you so much for watching the entire video. Do like, share and subscribe to my channel for supporting me and my channel, and comment down if you have any query or any doubt and in which topic you want the next video. Thank you so much for watching.